Hey guys, it's your girl Roxana. So I just want to let you know, don't mind the noise in the back. Kids are watching TV, so hey. So listen, I am doing this video because I want to make sure that you guys are aware. This is for a video for moms that are going to that are considered like high risk. It's a lot of misinformation out there, or information that is not given to you, and I just want to give you some tips of how to make it a better delivery for yourself and how it's better for your baby. Obviously you make your own decisions, and you do what you have to do for the safety of your baby and for the safety of yourself. But I just want to share with you my experience and why am I doing this video, because I feel like a lot of times in this medical field, it's about a business. It's not about how taking care of a mom or children and stuff like that. So first of all, just want to tell you a little bit about me. My name is Roxana, and I became a mom about when I was 35 years old. It was my dream to become a mom. I wanted to be a mom since I can ever remember being alive in this world, you know. So I lost my baby. I got pregnant back in I got pregnant back in 2017, and I lost my baby after about 14, 15 weeks. It was really hard for me. It was my first baby, and you know, I still go through a lot, you know. But as time passes by, you know, you kind of like, you know, the baby's not here, and just a little bit about that story, like, and the reason as to why I'm doing this video is because I feel there's a lot of misinformation. Yeah, first of all, for your moms that never been pregnant before and you are pregnant, make sure that you ask them to give you a test for HR antigen in your body. What happened was, it seems that my placenta ruptured, and I did not know that I have this thing that once you get pregnant, it's like your blood has something negative, and it can, like, it tries to get rid of anything in your body. It's like an antigen that tries to get rid of everything in your body. And what happens is, try to get that tested as soon as possible, because what happens is, if you do have the antigen, I believe, in your body, then if something happens with your embryo or with the, you know, with the bag or anything like that, it be able to save you a little bit more time, and for you not to have a miscarriage. That's a way of preventing having a miscarriage. My water ruptured, and I lost my baby on April 25th, 2017. It was gonna be a boy, and his name was Daedalus. And I miss my son a lot, and I believe he was gonna be a dancer, but anyway, based on that, then I had my rainbow baby, and my rainbow baby, it's Emily, which was born 22 weeks and 5 days. And just prior to that, I just want to let you know, I had a really bad experience when I had Daedalus. Like, I felt, when I went to Bridgeport Hospital, I felt like they were not, I guess they see this every day happening. I was part of probably another statistic, another Hispanic or another like minority being pregnant. You know, I just felt they didn't do enough to save my baby. Like, I was bleeding a lot. I was, you know, having problems all the time. And I just felt that they were not diligent enough. Like, I even asked, hey, can you take me off from work? Because, you know, when you're pregnant and you're having a lot of problems, it's important that you have your doctor that can say, you know what, stay home. You know, you can get medical leave, you know, and stuff like that. It's a lot that I'm going to be explaining in this video, so just, you know, bear with me, guys. I'm going to try to see if I can break it down little by little, but I just want to let you know a little bit of my background as of why I'm doing this video, so that you be aware of what's going on. So when the whole this situation was, the bag with the baby was at a rupture, and it took a couple of days because I had the antigen on my body. I guess the blood went inside the bag and kind of like killed the baby, and it caused for me to have a miscarriage. So if you're pregnant, make sure you get tested for that. I think it's called the HR negative or something like that on your body. And make sure you request it. Make sure they give it to you, especially if you've never been pregnant before and this is your first time getting pregnant. All right, so after that, I got pregnant with Emily. With Emily, like I kind of felt it that I was pregnant with her because I had a lot of the similar symptoms that I had with Daedalus. So she's my rainbow baby, and where's she at? My girly over here, she's a miracle baby. She was born 22 weeks and 5 days. With her, I had her when she was 1 pound 0.03 ounces. I was in the NICU. She's considered a nano preemie. I was in the NICU for almost 5 months after she was born, and I went through a lot, but I'll do a video on that and my experience with that and my experiences. So I just kind of want to give you a quick recap of everything. And then after her, I was taking care of myself. I didn't think I was going to get pregnant again. I wanted to wait at least a couple of years before I have another baby, but my boy, Jedediah, came along. So I don't believe in abortion. Hey, anybody who wants to do an abortion, I don't think is right. But if that's your body, you do whatever you want. But just make sure, take care of it so you don't have to kill a life. So Daedalus came along. Jedediah, came along. And I want to talk to you about that pregnancy. So because I had a pregnancy that was such a high risk, when you have pregnancies that are considered high risk, I had a miscarriage before, then I had a high risk pregnancy, having Emily at 22 weeks and 5 days. Obviously, they tell you, hey, you gotta come to the high risk clinic. So they tell you through all along, they want you to do throughout and then I'm a diabetic. That's another thing. When you're a diabetic, you gotta make sure you take care of yourself. And I wish I would understand this sooner. I feel like a lot of times doctors just have an agenda and they don't explain to you. They don't make you understand what's going on really with your body. So the fact that if you have diabetes, for example, I'm a diabetic type 2, because you're pregnant, the uterus tends to, the placenta tends to make your sugar be higher. So even though I was taking care of myself, it was just really hard for me. Like my stomach was all black. I kept on poking myself several times a day. More than it was almost 10 times a day that I had to poke myself, because you have to check your blood and you have to, poke yourself before you eat. After you eat, you poke yourself, and then you got to inject yourself with the insulin, sometimes 2 times or 3 times, because depending on the amount of insulin that they give you. Emily, can you please come down? So with that being said, I went through a lot. I went through a lot with Emily's pregnancy and Jedediah's pregnancy. Not so much with Daedalus, but with both of the last 2 pregnancies, I did went through a lot. So with that being said, I just want to let you know that if you're a diabetic, take care of yourself. Make sure that you have a good way of eating. Make sure you have a good regimen of the medication that you're going to take, because that's going to help a lot, and it's going to determine how long your pregnancy is going to last. For Jedediah, the pregnancy wasn't bad. The only thing, I was really emotional, I guess, because everything that I've been through. I got pregnant when Emily was 3 or 4 months in the NICU when I got pregnant with Daedalus. With Jedediah, I'm sorry. May Daedalus rest in peace. And I went through a lot. It's been a rough couple of years. But I wouldn't change it for the world, because I have my children, even though I lost one, and hopefully, I believe in life after death, and hopefully I'll be able to see my son and be reunited again with him. But right now, he's with God, and he's another angel, he's my guardian angel. So with that being said, one of the things that this is my suggestion, because you don't want to make that experience so negative. And they don't say it, but being induced in labor, it's a very negative experience, and it's an excruciating experience, and it's something that it's gonna not want to have for you. You're not gonna want to have no more babies. I don't care what they said, despite the fact that they were cool, because I was able to have Emily in the room with me until I actually gave birth. But to able to have family members, because I suffer from anxiety and depression, I just couldn't be away from my baby, and I couldn't have my baby somewhere else. So it was just it was nice, the fact that they let me stay with the baby in the room until I was able to give birth, right? And the father of my kids was there, and my aunt was there supporting me, and stuff like that. So it was good that they were there. But what I did was I prepared myself. Like I had one of those playpens, and I had her favorite blankie and her favorite pillow, and I try to make as possible as comfortable as she could have, so that the stay that I was there 2-3 days, she was with me 2-3 days there. All right, so first of all, they don't explain to you inducing your labor. It's like forcing your body to give birth. And when they forcing your body to give birth, it's like it hurts like 100 million times more than it's supposed to. Me, if I would have known this, that was the most, like, they put their hands in, they put all this crap in there in your kuka. Like, it's just horrible. And I'm not trying to scare you, but I'm just, and people can tell you, like, I started asking people about how was their experience, and they're like, yo, it's painful. It's painful. It's rewarding. That tell you it's rewarding, but this is like a psychological thing that the doctor tell you, but you know, at the end you're gonna get all the, no, I'm telling you right now, if you are having a high-risk pregnancy, it's better for you to have it just set up where you're gonna have a C-section. And I'm gonna tell you this, if you're diabetic, or if you have back problems, or if you're one of those person that have a lot of kids at home and you really can be like in pain or like that, one of the things is you ask them to give you full anesthesia. Okay, make sure the father of your children is there. Make sure you have support, so when that baby comes out and that baby needs to be fed, because that was another thing, and I'm gonna do another video of my experience with that. When my son was born, Jedediah. So anyway, so make sure if you're diabetic, or you have heart problems with your back, or you just simply are like, you know you're gonna be at home alone with the baby, you don't need to go through all that pain, because having that needle in your back, it hurts. Okay, and they do it like that epidural. Sometimes it takes it, sometimes it doesn't take it, and they have to be poking, and that's gonna mark you for the rest of your life. You're gonna have back pain for the rest of your life. Okay. Emily, can you please get down? Thank you, mommy. So what I've been telling you, if you are high risk, my recommendation is to do a C-section. That's my recommendation. Let me tell you, in a couple of days, you're going to be fine. You're going to be able to see the baby. Make sure you have people there. They know what to do with your baby. Because just quick, Jedediah was born. I had a full anesthesia. They let me rest for 3 hours, right? So they, according to the doctors, they say, oh, we don't do full anesthesia unless it's something like dramatic or something like that. No, that's to make it easier for them. That's to make it cost efficient for them, okay? You can request, if you, I was paranoid to have that. I suffer from anxiety. I was paranoid. I was like, you have a baby at home. I'm going to be cut. I have diabetes. You don't know how's that going to react. You don't know how your cut is going to react. So I was like, no, I want, if I have an IV, why there's a problem that you can give me the epidural to the IV, and they can do that. And they'll tell you, oh, we're not, that's bull crap. They can give you epidural to the IV, and they're just going to numb you completely. Another thing is, I have a big belly. Like, I have a big belly. Like, I need to do a tummy tuck because that's how big my belly is. And on top of that, I'm a diabetic. You know how the incision is side to side? You don't have to get that incision. My recommendation is, and I'm telling you, I heal faster. I feel like it was better for me. Even though I caught an infection, and then even my doctor was like, how is it possible that you caught an infection? That only happens like in third world countries. So something must have happened there. I had a really bad experience at Yale University, at Yale Hospital in New Haven, Connecticut. Some doctors were really good, but some of the doctors that I had that night, they were like butchers, okay? They didn't care about my feelings. They didn't care how I felt. They were pushing me to like, oh no, but you need to do the incision side to side. No, I don't, because I have a big belly, and it's gonna be overlapping. It's gonna be overflapping, and that's not good. You know, so I told them, can I get my incision done up, down? So up and down is better when you have diabetes because it cures faster. And not only that, is better and I'm talking about my experience, and it's better because you're not touching, like it doesn't take long for that to heal. And I'm telling you, when you go to the bathroom, you have to push because you get constipated. You don't have as much pain. And then they were giving me like morphine. I'm like, I don't want morphine. Can you just give me Motrin? Literally, they say, oh, we're not gonna be able to give you Motrin, you know, because you need to take the morphine. I'm not here to get drugged. I'm here to be able to see my baby, and to, you know, and I was walking within the next day. I was walking, the next 2 days I was walking. I was in there because my son had to be in the NICU because of what they did. My son stopped breathing and he turned blue because they were so irresponsible, and I'm going to talk about this in another video. They were very irresponsible. They gave the baby to the dad. There was no nurse there to say, hey, you know, I'm here so you can feed the baby. And see, thank God my aunt was there, and if it wasn't because of my aunt and the dad that he tried to, like, you know, do the CPR, you know, stuff, my son would have been there because there was no nurse there. You know, I guess they were mad because I requested for my C-section to be, like, you know, through the IV. The doctor was very upset because he was like, oh, you know, I don't understand why you're giving us a hard time. I'm not giving you a hard time. I'm giving myself a easier time. I have 2 babies at home. Hey, baby. I have the baby at home, which was Emily. She was still baby. And now Jedediah was going to be home, you know. And I'm home alone. So just to recap quickly, if you are a mom that is going to be having a baby and you high risk, or even a regular mom, and you don't want to go through all of that craziness of being induced, because being induced is actually they forcing your body to give birth, and then they give you pitocin, which is like an hormone that it's like the pain is like 50 times more than regular pain, you know. And if you don't believe me, you guys can like search other videos of nurses talking about it, you know. And it's a really bad experience when they induce your labor. The best thing is just schedule a C-section. Your incision, make sure it's up and down, okay. And another thing is also make sure that your IV, like your you know, the numbing, that they just numb you, because you're gonna be fine. They were like, then they tell you, oh, but you know, you can die even with a C-section, you can die even giving birth. So you know, the risk is not that high. If you had a procedure done before and you've done, you know, anesthesia before, what they do for you is nothing that they can. Let's say, for example, you're gonna go get breast implant, they're gonna put you under anesthesia. So why can they put you under anesthesia to have a baby? You understand what I'm saying? So, you know, I just wanted to share with you guys that if you have any questions, you know, comment below. Anything that I can help you with. Like I said, I'm a premature mom, I'm a preemie mom. And, you know, I just want to make sure that you guys, you know, we go through so much, you know, in that experience. It's all worth it because we have our children, but it's just a very dramatic experience. So please make sure to subscribe to my page. Make sure to like my video, and give me some feedback. Let me know what you guys want me to talk about. I have so much to say, and I will break some of this thing down. If you have a question about in regards of anything that I said and you're just not clear, please give me a question, and I will definitely do a video and I will answer all your questions, guys. Thank you so much, and embark in this journey with me. Thank you guys.